exciting things happening here. But right now, I just gotta say, I got the whole world
Yeah, you do.
in my hands. I got the whole world.
Love it. Thank you very much, Bridget Ryan. As we're joined now by Dr. Don MacDonald from Southside Chiropractic. Welcome back.
Thank you very much.
We're talking shoulder injuries today. What causes them and how to prevent them. How come? Is this the time of year where you see more and more of these in your clinic?
Well, we're just seeing more and more frequently because of computers and the way people are sitting all the time.
Okay.
So most of the time people are thinking of, we're not talking about shoulder injuries like I was playing hockey and I rammed it to the
Right.
side. Most people that are getting shoulder injuries nowadays, they've tweaked it, and it's what we call an accumulation injury. So we can bring it all the way back to posture, is that we're always trying to correct posture to keep the shoulders back. Now what happens, and I'll just demonstrate on you,
Sure.
is that you've probably seen people that are starting to become a little more hunchback nowadays, especially with all computers and sedentary lifestyle. What happens is that the shoulders start to roll forward, and when the shoulder starts to roll forward, it puts the whole mechanics off in the shoulder. So normally we should have the shoulder back, so it should be up nice and straight.
Okay.
And then what that does is it equals out the pressure to the whole shoulder girdle.
So you're talking about this is something you want to focus on when you're sitting at your desk, sitting at a table, just standing, is keeping those shoulders back.
You betcha.
But the posture starts at the core, doesn't it?
Yes, it does, but it's in all different, it actually can affect a whole bunch of different things. There's probably about 10 or 15 different things that can be affected from bad posture, all the way down to bunions on your foot.
Wow.
Yes.
Unbelievable.
So what I'll do is I'm just going to show one of my little videos, and what this will show is that when the shoulder is forward, when you just do your day-to-day activity, it can create things like tendonitis and overuse syndrome just because the whole position of the shoulder is not in the correct position.
I just appreciate that you've adequately represented my pecs there in your demonstration, Dr. Don.
You were the model for this. So as you can see, this is normal movement. But what happens is when the shoulder starts to go a little bit more forward, we can start to see the top, this muscle, this ligament starts to get inflamed. And if you've heard of torn rotator cuffs, that's where that would tear right across the top part.
Okay.
So when you go to a chiropractor, what we want to do is we want to usually correct shoulders. So there's a few little things that you can test on yourself at home to see if you're at high risk to get a shoulder injury. One would be you'd put pressure in on the pec. And if that is pretty tender, that would tell that the pec's pretty tight and it's pulling it forward.
Okay.
The other would be in your rib. So you go down the ribs at the front, and then sometimes you'll find like a rib that's really quite tender at the front, and when that's out of alignment, it makes the pecs go tight, which puts the shoulders forward.
So pain in your ribs could indicate a shoulder problem.
Because you're protecting.
Okay.
Yeah, whenever you have protection. And then also down between the shoulder blades. If you're tender.
I can spin around so you can show our viewers exactly
Yeah,
where you're...
so when you come down in here, it's kind of right in between the shoulder blades. So again, when that shoulder's going forward, you're going to be pulling, this is called the rhomboid muscle, and that'll put a lot more tension on there. And the one last one is called the infraspinatus muscle, and actually you'll find that's probably a little tender on you. Most people, that's tender nowadays just because people have rolled forward shoulders.
Okay, so the number one thing to keep in mind in avoiding these types of problems then is posture.
Yes.
Okay.
For sure.
How about any other pointers or anything else people need to keep in mind? You mentioned sitting at computers. Is that all a result of because people are so hunched over a keyboard?
You bet.
So what do you suggest?
Well, wait, when you're sitting in front of a computer, you want to make sure that you're sitting up straight. Most people's computer screens are too low. So what you'd like is you want to make the computer screen up high enough so that you're looking straight across at the top line of the computer screen. And you also want to make sure you're close in. And a lot of people, they don't have their keyboard trays or their mouses on the right, at the right angle so that they're reaching for it. Especially if you're always reaching for the right mouse, that's going to bring that shoulder forward, which is going to also create more problems.
Okay. Dr. Don MacDonald, Southside Chiropractor, thank you so much. And thanks for the video. You know why they call you Dr. CSI around here. It's
I know.
These fancy videos. Thanks very much, Doctor. You'll find his information on our website, breakfasttelevision.ca, under the Inside BT link. When we come back, Bridget Ryan from the TELUS World of Science.